Hey guys, it is time for Chapter 9, Phlebotomy, in Phlebotomy's Lesson 2. We're going to pick up where we left off from the last time. When we finished, we were talking about the correct position a patient should be in to draw blood. So today we're going to start by talking about the tourniquet. The job of the tourniquet, first of all, is to increase resistance to the venous blood flow. We had talked about that in the last chapter as well. And as a result of that, the blood flow coming down to the veins, or I should say as it is returning back to the heart in the veins, slows down. And so that makes it so that we can see and feel the veins more easily. When we are putting on the tourniquet, you need to put it on about 3 to 4 inches above the site where you're going to draw blood from. A couple things to keep in mind when we're putting on a tourniquet is that, first of all, it should not ever be put on for more than a minute. And the reason is that the blood can get too concentrated. That's called hemoconcentration. And as a result of that, it can affect the test results and make them inaccurate. Another problem is that hematomas could occur. You draw the blood leaks from the vein, and then it starts filling up and creates almost like a tumor of blood and a big old nasty old bruise. When you're putting a tourniquet on, it should never be done over any type of open sores. If your patient has had a mastectomy in the past, then you need to use the opposite arm. Many times when women have a mastectomy, they remove the lymph nodes in that same arm. And so as a result, some of that extra stuff can't be drained. And so women who've had that done need to have blood drawn in the opposite arm. If they've had a double mastectomy, they may have one arm that they have to use and that kind of thing. So basically those patients are told by the doctor which arm to use when they get blood drawn and that kind of thing. When you're putting it on, make sure that it's not rolled or twisted anyway. It would pinch the patient's arm and it does hurt. And it can lead to a bruise then, and you don't want that. You want to put it on tight enough that it slows down the blood, but we do not want a tourniquet on so tight that it completely stops the blood flow. But you also don't want it too loose, and then you don't have any slowing down of the blood at all. So there's like that kind of perfect middle that you have to find. When I mentioned this before, I think, when you are looking for veins, you want to stick ones that you can feel more than the ones that you can see. If you're looking for these veins and you can't seem to find one after a while, remember that the time limit is 1 minute. And so after that amount of time, you need to take the tourniquet off, let it off for about 2 minutes, and then you can reapply and look for the veins again. And basically you're giving the patient's arm a break from having the blood supply cut off or slowed down from it. As far as choosing the site of your blood collection, typically the site that most people have blood drawn from is what's called the antecubital space. It's the front of the bend of the elbow. But you need to make sure there's no scars, none of those hematomas that we talked about, no burns, and no swelling. And the reason with the swelling is that the edema, which is the swelling, can have extra fluid, and you don't want that extra fluid affecting the test results. In extreme cases, sometimes phlebotomists have to draw blood from other sites other than the arm or hand, like the foot or the scalp. It's actually pretty common for babies to have IVs and blood drawn from their scalp. They have nice prominent veins there. But before doing that, you need to make sure that there's no policy against that. For instance, one of the hospitals I worked at, there was a policy against drawing blood from the feet because of the increased risk of a blood clot being developed. At another hospital I worked at, it was okay. You were allowed to draw it from the foot. So it all depends on where you work in those policies. The other thing to keep in mind is many times our patients have, when they're in the hospital, have IVs in them. And when you remember, when blood is being returned back to the heart, it's being returned through the veins. And so if you have an IV in the hand and you try to draw blood above it, you're getting the IV fluid in. And so, of course, the test results would be affected and they wouldn't be very accurate. And so you should never draw blood in an arm with an IV in it. You need to use the other arm. If for some reason that arm you can't use, then you need to have the IV turned off, allow it to be turned off for a while, and then draw some extra fluid off first, and then draw your blood samples. As far as I'm just gonna let that ring a second. Sorry about this, guys. Of course, the phone would ring, right? All right. So as far as cleaning the site, there are some standards. Basically, once you find the site you're going to draw, you're going to remove the tourniquet. You're going to clean the site that you're going to use with alcohol and allow it to dry, then reapply the tourniquet to draw the blood. What we use to clean the site with is 70% isopropyl alcohol. That's the same stuff that we have in the alcohol wipes, so that's why they use the alcohol wipes. You start at the site and work your way out in a circular motion out. So you kind of start here and you work your way out in bigger circles. It's important that you do allow that to dry completely before you stick the person. First of all, it's going to kill the microbes that are there. Remember, you have bacteria and stuff on your skin naturally. If you don't wait for it to dry, it can hemolyze the specimen. It's going to make the patient uncomfortable because it does hurt. The other thing to keep in mind is you do not wipe or blot it dry with gauze. You just allow it to air dry. Don't blow on it because you don't want to contaminate it. And then after you've cleaned it, don't touch, even with gloves on, the site where you're actually going to put the needle in. You can touch a little bit above and then roll your finger up and then slide your needle in underneath that. But you don't want to put it right where you're going to draw blood from. One more time, a second here. You want to anchor the vein. Make sure it's firmly secured in place. Some people have veins that roll to one side or the other. So basically, you put your hand above it, your finger, and you kind of hold it in place, and then roll up, and then put your thumb under the bottom, kind of hold it like this, to make sure that it stays in place. And then you stick your needle in above that, and then you can perform your venipuncture and draw your blood specimen. And you hopefully have gotten your blood. You label your specimen, and put stickers on it depending on what the hospital policy says to do, and you go from there. All right, so tomorrow will be review, and we should be ready for the test then. If you have any questions, send me an email. I'll be happy to answer them. I'll talk to you later. Bye.